Let's talk about acamprosate, one of the most commonly used drugs for alcohol use disorder. Ever since it was introduced as Campril in 2004, acamprosate has been considered an essential medication in the treatment of chronic alcohol use disorder. Even today, guidelines still recommend acamprosate as a first-line treatment for this condition. But how does acamprosate work, and why is it so effective for this condition? So we still don't exactly know how acamprosate works, but we have a general idea. Studies have found that acamprosate modulates NMDA receptor and GABA-A transmission, which ultimately lowers glutamate levels. This is important as glutamate is the main excitatory neurotransmitter in the body. What we found is that when people drink alcohol, especially chronically, the body's glutamate levels will actually decrease. Now the body wants to bring those levels back to normal. So once alcohol is out of the system, the body will do exactly that. It will bring the glutamate levels back up and increase production of glutamate. So what we see during withdrawals is that those glutamate levels will skyrocket. The problem is that increase will cause a lot of those withdrawal symptoms that we see, like cravings, anxiety, and restlessness. And those feelings can be very brutal for our patients and can make the whole process of abstinence be, very unbearable and brutal, and could really lead a patient off of their plan to stop drinking alcohol. So what we can deduce from all this is that acamprosate should mainly work by indirectly lowering glutamate levels, so that patients should not experience those withdrawal symptoms. And by doing that, it can make the whole process of abstinence a lot easier for our patient and make it possible for our patient to achieve their goals of not drinking alcohol anymore.